CheckMate 17 and CheckMate 57 were the first randomized trials that investigated the efficacy of checkpoint inhibitors in pretreated patients with advanced non-small cell lung cancer. Both trials were highly positive in terms of overall survival, so we have seen a significant prolongation of overall survival for the PD-1 antibody nivolumab compared to standard chemotherapy in patients with squamous cell lung cancer as well as in patients with non-squamous non-small cell lung cancer. The promise of immunotherapy is the promise of maintaining benefit. And this is something which we updated this year at the ASCO meeting. So we looked for the 2-year survival rates. This is something which we normally do not observe in non-small cell lung cancer, in particular in pretreated patients. And we have seen a substantial 2-year survival rate in patients with squamous cell histology as well as in patients with non-squamous cell histology, which means that indeed there is a group of patients who does have a long remaining benefit from treatment with a checkpoint inhibitor. The other thing that we looked at in the CheckMate 57 has been the quality of life and the control of the symptoms. And again, it seems that the data do favor the treatment with the checkpoint inhibitor nivolumab. The question of immunotherapy is the question, are we able to select patients who benefit best from this new treatment approach? The question is difficult because we are not talking about an oncogenic alteration like the EGF receptor mutation. We are more talking about a surrogate marker to increase the chance for response. And currently, the best marker that is available for practical use is the PD-L1 expression, and this has been confirmed here at the ASCO meeting. But besides that, we are also looking on other opportunities to select patients, and very interesting markers come from the research for mutational burden of the tumor. So we do see an association between the mutational burden and the susceptibility against the checkpoint inhibitors. And the other thing which has been heavily discussed here at the meeting is the question of an inflammatory signature. So we do see certain signs of inflammation correlating also with the efficacy of the immune checkpoint inhibitors. Now we do have the opportunity to use checkpoint inhibitors in pretreated patients with advanced lung cancer. The next step is to look on the efficacy of these compounds in untreated patients. And there we have two strategies. Number one is to look on the efficacy of monotherapies with the checkpoint inhibitors against platinum-based combinations in selected patients, in patients with PD-L1 positive tumors or high PD-L1 expressing tumors. And the other option that we are currently exploring is to look on the efficacy of checkpoint inhibitor combinations in untreated patients with advanced non-small cell lung cancer. We started to explore to look on the efficacy of checkpoint inhibitors in patients with non-small cell lung cancer because this is the largest entity that we are treating. But now we are also investigating the efficacy of these exciting new compounds in other thoracic malignancies. And so far we have seen quite encouraging results in patients with advanced mesothelioma. And we also have seen quite encouraging and exciting results in patients with pretreated small cell lung cancer. And now we have randomized trials going on to prospectively investigate the efficacy of these compounds also in these thoracic tumor entities.